Good morning, everyone. I was tasked to deliver today a very broad topic, and this is workplace ethics. There would be two parts in this lecture. The first one I'm going to give today or discuss today, and then the other one would be given next week. I would like to simplify this discussion with the hope that this would be well understood and well remembered, especially as you join the healthcare workforce. So the objectives of this study, of this discussion would be the following. First is to define workplace stress, and then aggression, competition, and cooperation. And then we would attempt to understand how conflict arises at the workplace, and then discover techniques on managing workplace conflicts. Now, there are four keywords that need discussing in order to address basic workplace conflicts. These are workplace stress, aggression, competition, and cooperation. The significant presence of the first three will precipitate conflicts, while the lack of the fourth one will do the same. Let me start by stating a fact that there is no perfect work and workplace, inasmuch as there is no perfect worker. The workplace environment, and workers play hand in hand to the promotion of harmony to avoid unimaginable stress. Stress in itself is not at all bad. Stress is the force that propels individuals to move in different directions that are supposedly purposeful and gratifying. However, when stress becomes intolerable, it may cause havoc in both personal and professional life. So stress, by its general definition, is both mental and affective condition that can be translated to behavioral phenomenon, meaning it affects our way of thinking, feeling, and eventually behaving. It is a state of mental tension and worry because our problems in our life and workplace are really bothersome and really sometimes disruptive. And this causes strong feelings of worry, feelings of anxiety, or even feelings of depression. Stress is an everyday part of life. It could either be normal stress, or we call eustress, and excessive stress. Eustress is a natural force in life and work. It helps propel individuals towards achieving objectives and goals. It also facilitates mobility towards directions directed by or dictated by institutions. In this case, response to the usual stress is highly dependent on the person, and tolerance to such is influenced by many internal and external factors. Internal factors refer to what is inherent in the person himself. This includes temperament, motivation, previous experiences, and resilience. External factors are those found in environment, such as resources and situations that can be supportive of the stress or otherwise. While normal stress can be beneficial, excessive stress, on the other hand, may adversely impact people in their performance of daily activities and responsibilities, thus may hamper also their productivity. This is the kind and degree of stress that stretches endurance and resolve to pursue a goal or interrupt a process or challenges a status quo. Excessive stress affects our emotions and therefore our moods. Moods can direct our attitude at work and in healthcare, where we put high premium on empathy. Loss of interest on patients and apathy results to poor medical services. So with excessive stress, we can become anxious, irritable, or depressed, or we may even be apathetic and may lose interest at work. When we get preoccupied by the things that causes our worry or things that cause our worries, we find it hard to sleep. Then with a lack of sleep, we become exhausted, ruminating the stressful situation over and over again, hoping to find our way out of it. As we dwell on stressful situation, we become distracted, lose our focus to the task at hand, and have trouble concentrating. This will pose as a very dangerous predicament when we are faced with responsibilities that require critical decision-making and skill precision. Focus and concentration are very crucial in making life and death decisions, especially in hospitals. Stress also has the capacity to manifest as physical discomforts, whether imagined or not. Underlying health issues such as asthma, allergies, diabetes, peptic ulcer, hypertension, and migraines may exacerbate in the presence of stress, and all bodily aches may be felt when stressed out, and only to disappear when one is relieved of the stress. So we call this psychosomatization. Stress may also hamper our ability to engage in socially acceptable manner. It can either cause a person to socially disengage by being disinterested or resentful of human interaction. Some may seek comfort only to compromise one's well-being by substance abuse or other reckless behavior. So what are the common causes of workplace stress? First is the feeling of powerlessness or not having enough control on what is happening around you. And it can be a very potent source of stress. So too much responsibility with too little authority. You have a pile of work and you don't have enough authority to tell other people to help you out with that responsibility. Unfair work practices, like for example, you are a clerk at the hospital and you are being told to monitor the patient when you know that it's the nurse's job to monitor. Inadequate job description. So as a clerk, you don't know whether you are a student first or a part of the workforce. The fear of being terminated or the fear of being reprimanded or the fear of being suspended. And of course, more overtime, especially if you are being requested to do an assignment. And of course, there's the pressure to perform in order to meet rising expectations of your residents and of your consultants, and even the pressure to work at optimum levels at all times, which should be expected since the medicine would only allow a very margin, if not at all, very small margin of error to commit mistakes while in the job. A lot of times, stressed individuals feel the mismatch between their goals and the things that they are doing. Some cannot reconcile their expectations of the job to the actual job that they are performing. It's a feeling that you are a square peg being hammered to fit into a round hole. And others just feel and think that they are not just in the right line of job. This is the reason why some would do a sabbatical. However, less than being discouraged, lifelong goals and aspirations can be achieved amidst stress. There is an adage that says, rest if you must, but do not quit. Or something like, what can't kill you will make you stronger. Some individuals feel that stress in workplace is like a golden shackle. It's tied up to their sources of income and prestige and no way of getting off from it. Clinical clerks may likewise feel being shackled to 1 year of training in order to graduate. Next is traumatic experiences or traumatic events on the job. Job experiences, whether recent or remote, can be sources of stress by causing a shift in the attitude or outlook. Traumatic work experiences is another cause of stress. This may create fear, anxiety, and demotivation in some. This makes almost every workday as an excruciating experience for those whose work left them with so many scars, whether it be physical or psychological. It becomes a kind of misery for clerks to be subjected to hospital setting over and over again when they had experienced past traumatic experience in the same setting. Another is work setting. Work setting is crucial to the formation of motivation in every worker. Work setting can either cultivate an environment that is nurturing and challenging, or tense and frightening. The culture of workplace is also essential to the development of human resource. How people are expected to render their work and relate among each other is very important to the degree of stress in the workplace. Let me mention that work setting includes the physical infrastructure of the workplace, the organizational structure, and the management of the workplace. Hence, if the facilities provide adequate comfort and management of the same institution offers compassion, growth, fairness, equity, and security to its employees or workers, then stressful situations can be toned down. How to deal with conflict associated with workplace. The key to the management of stress is trying to figure out why are you stressed. Defining your stress and the source of it helps you take the first step in doing something to relieve it. In workplace, try to initiate and maintain positive relationship with people you work with, be it nurses, residents, office staffs, and fellow clerks. People around you can either lessen or aggravate the load of responsibility that you carry. When relationships are harmonious, life and work is a lot easier. Take good care of yourself by eating well and finding rest. One has to have a good time management in order to balance work and play. So, you have to prioritize and organize in order also to have some playtime in order for you to relax. In other words, organize and systematize to be effective and efficient. Efficiency means getting the job effectively done with the less amount of time and even resources. If some habits will do more harm than good, then those habits are not anymore helpful, thus needs unlearning. Positive relationship is enhanced by good communication. As you move around the hospital, try to be amiable to everyone. Be respectful and kind because the good vibes that you create will always come back to you. The second challenge that one may face in workplace is aggression. Aggression is any behavior that is meant to harm another person or group of persons. This can be verbal or physical or both. This is the most palpable sign of workplace conflict, the one that needs immediate remediation as it carries obvious effects of work environment conflicts. While aggression is typically seen as an active attack, some forms of aggression can be passive. We call this passive aggression. Usually, this is shown by subtle resistance to cooperate and do the task below satisfactory level, or staging a sabotage. Either way, passive and active aggression can cause havoc as it escalates to unacceptable and disruptive behavior that often ends in violence at work. So its impact in organization can be damaging because aggression is disruptive to the whole organization as victims becomes overwhelmed and depressed, while other workers will develop the fear or anxiety of being victimized the next. Aggression should never be condoned with. This is counterproductive in any workplace. It should be acknowledged when present and be acted upon so as to resolve it. Competition. Competition is defined as any effort of two or more parties acting independently to secure the approval of a third party by offering the most favorable terms. This can be beneficial as this will encourage others to work more efficiently enhance creativity, and produce better quality output or performance. However, competition can be harmful to organization if there is an indiscriminate need to compete and win at all costs. This behavior can produce nasty behavior such as over-aggressiveness, hoarding resources, sabotaging the work of others, taking credit for others' work, and self-promotion at the expense of others. Competition can also have detrimental effect on psychological makeup of people, like memory and performance. Being constantly hypervigilant and pressured to achieve more contribute to work stress to persons and strains on relationships. Competition can also dampen self-esteem and collegiality. Nobody wants to get beaten up, and it's not very pleasant to experience losing to somebody at the same workplace. So competition is actually rivalry for supremacy. It is a contest between rivals because the effort of two or more parties would act independently to secure the approval of a third party, and that is by offering the most favorable terms. So, clerks would be pitted against clerks, by residents probably, or by consultants probably, with the hope that they would perform well. However, sometimes the competition can be vicious, and this would result to strained relationship or even sabotaging one's work or the other's work in order to be on the top. Winning at all costs may compromise teamwork. In healthcare setting, all efforts are directed towards helping each other to achieve the best interest of the patients. Doctors should have good camaraderie in order to work in harmony for patients and not to hold themselves superior to their colleagues. There should be a good sharing of scientific knowledge and skills expertise. So competition in healthcare is almost always unhealthy because of the principle that every person should win at all costs. If competition is unavoidable in the workplace, the following can be helpful. First, know your strengths or limitations, uniqueness, and have an honest appraisal of yourself. Second is to assess the workloads and divide the task. Be equitable in task assignments. Then collaborate on the goals that are assigned. Remember that in healthcare, it's for the benefit of the patients first before anything else. Be appreciative of your company and the efforts of each person in the group. Be gracious and respectful in stating suggestions or dissenting opinions. With or without any other person to compete with, maintain high quality of work always. Outdo yourself in every opportunity. Then, if there are things that cannot be resolved, talk to your superiors for guidance and for resolution of conflicts. Cooperation is the opposite of competition. Cooperation is a process where groups or people work together and acting together for common or mutual benefit, and this is opposed to working in competition for selfish benefit. Cooperation fosters openness, trust, and safety. It encourages shared decision-making and teamwork. And this is in contrast to competition where there is difficulty to maintain positive feelings about someone who is trying to make you lose. Cooperation improves self-worth, personal power, and well-being. It creates an atmosphere of playfulness, bonding, and support which are essential to diffuse stress and pressure in the work environment. There are challenges to cooperation. One is personality differences. There will always be a colorful array of personalities and profiles in any group or of work environment. It will be helpful to establish firm expectations and guidelines among the members so that each one will be expected to contribute and avoid being a piggyback rider. There will always be work differences within the ranks of workers. Therefore, specific work parameters and directives should be established. All clinical clerks belonging to same rank in the ladder of medical training. However, not all clinical clerks may have the same workloads as they will be assigned to different units at different times. So specific work parameters and directives should be set. Should ego tripping and control struggles happen, handle situation by citing specific roles and responsibilities. Always stick to the job or task description, as this will define the course of action each person may assume in workplace. So be very specific about individual roles and the responsibility of each person in the workplace. As conflicts are about to arise, try to prevent it. Be proactive. If there is a strong potential for conflicts, you either eliminate the cause or substitute the circumstance with a more acceptable one. In the occurrence of conflicts, make sure and make use of the organizational formal reporting system. In the hospital, we have IR, or we call that incident report, or in some, notification report. This would bring conflict to the attention of the immediate superior for mediation. Counsel employees involved in conflicts, and you do this non-judgmentally. You can always lend this a helping hand to your fellow clerks later on if they experience engaging in or being a part of a conflict. If there is a good opportunity to mediate effectively, do so in a manner that is acceptable to all. Be fair to everyone involved. Always refer to the company policy. This is to direct how mediation of conflicts would occur. Then create a paper trail of all mediation proceedings by carefully documenting the reports. This is very valuable when formal complaints or litigation process is warranted later on. So which is better, to compete or to cooperate? Competition generally does not promote excellence because trying to do well and trying to beat others are two completely different things. Competition is associated with decreasing work performance, and to prevent conflict, one should consider how competition might be minimized. Cooperation, as often said, promotes higher achievement than independent work. It is said that 2 heads would be better than 1. Avoid unhealthy competition and promote cooperation instead. The life of clinical clerk can be both challenging and indeed stressful. However, with the right attitude and mutual support from each other, this can be the most bittersweet experiences of one's life. Master the art of cooperation and collaboration, because conflict management always requires prevention of unnecessary competition for valuable parties. Cooperation increases productivity, enhances morale, and lead to a positive and healthy workplace. You need not only work hard to survive clinical clerkship, but you must also have cooperative spirit in order to sail smoothly and enjoy that experience. So conflict management requires prevention of unnecessary competition, especially of valuable parties like clerks versus clerks, residents versus residents, consultants versus consultants. Instead, a cooperative spirit should be the one that should circulate among healthcare teams. Remember that life would be easier if you are in collaboration and in cooperation than in competition with each other. So in managing conflicts, try always to cooperate and collaborate, because by cooperation and collaboration, conflicts can be easily resolved. With this, I end the first half of my lecture, hoping that whatever conflicts that are brewing up later on can be averted as soon as time possible, and whatever ongoing conflicts that is being experienced can be resolved effectively. Thank you very much for your kind attention.